I have a great deal of interest in research in some women's health areas. More recently, I've been a co-investigator with a trial of using gabapentin as a treatment for vulvodynia. Vulvodynia is a composite of two words, vulva and dynia. And vulva refers to the skin outside the entrance to the vagina. Dynia is another word for pain. So simply put, vulvodynia is a pain in that area, in the genital area. Recent large studies in the United States have told us that over 30% of women have this problem at some point in their life, and right now 16% of women are suffering from vulvodynia. So for the type that we call provoked, which occurs with intercourse or touching, the symptom is pain whenever there's an attempt to insert a tampon or have intercourse, and often that pain is of such a level that it's preventing intercourse and intimate relationship. The second type is a continuous abnormal sensation, usually described as burning, and so those patients have been seeking help with a burning problem and usually have tried a number of treatments without a clear diagnosis or a successful treatment. Despite how common this problem is, most women who have the problem are surprised to learn that because they think they're the only one. Obviously, this isn't the type of thing that you talk about with friends or at a party, and so it's a hidden problem in the United States. Diagnosis is part science and part art, and there's many areas where the art becomes more important than the science because there may not be a particular test that's definitive. And the art of diagnosis is really listening, and I will continue working with you until we've had success. There are many treatments for vulvodynia. We like to start with a topical treatment because it doesn't have any adverse effects beyond the region that's being treated. So some of the common treatments would be to use a topical numbing ointment or to apply a topical steroid in some cases. There are also compounding creams and ointments that can be made up that contain various medications so that they can be applied topically to the skin rather than through the whole body. Sometimes we use injections of a numbing medicine and a steroid into the skin area. Patients with vaginismus, extraordinary tightening of the muscles, sometimes have an injection of Botox. After the topical treatments have not worked, it's possible to use systemic medications taken orally, which go all through the body, and we have to pay attention to drug-drug interactions and other issues with those types of medications. If the patient has localized provoked vestibulodynia, meaning there's a very small patch of hypersensitive skin that's very painful to touch, then surgery may be an option for that if the non-surgical treatments have not been successful. And that surgery involves removing that area of skin and then repairing the area. Theoretically, the vulva is just another part of the human body, and we should be as interested in the health of that area and as able to talk about it as any other healthcare problem, but realistically it's a sensitive subject area. But if you do have a concern or a question, it's important to see someone who's an expert so that you're going to get a proper answer.